the DIABOLO trial. Welcome to today's episode, where we will be taking a closer look at the DIABOLO trial, a landmark Dutch multi-center study that fundamentally changed the way we think about antibiotics in the management of acute uncomplicated diverticulitis. The DIABOLO trial investigated whether it is truly necessary to prescribe antibiotics for patients experiencing their first episode of acute uncomplicated diverticulitis. Remarkably, the study found that simply observing patients, rather than routinely administering antibiotics, was not inferior in terms of patient outcomes. In other words, patients who did not receive antibiotics did just as well both in the short and long term as those who did. Let us break down the essential details of this influential trial, following a structure similar to previous summaries we have shared, such as that of the AVID trial. The trial was officially named DIABOLO, which stands for Diverticulitis, Antibiotics or C-Lose Observation. Its main objective was clear: to determine whether an observational approach, without antibiotics, could match antibiotic therapy in terms of time to recovery for a first episode of acute uncomplicated diverticulitis. The DIABOLO trial was conducted in the Netherlands between 2010 and 2012. It was a multi-center, open-label, randomized controlled non-inferiority study. In total, 528 patients participated, all of whom had a diagnosis of primary, left-sided, acute uncomplicated diverticulitis confirmed by computed tomography. Only those in the earliest stages of the condition, specifically Hinchey stages 1A and 1B, meaning inflammation or a small abscess less than 5 centimeters, were included. The researchers excluded anyone with previous episodes, immunosuppression, sepsis, or significant comorbidities. Participants were randomly assigned to one of two strategies. The first group followed an observational strategy, receiving supportive care with antibiotics only if deemed necessary later. The second group received a 10-day course of amoxicillin clavulanate, starting with intravenous administration and switching to oral therapy as appropriate. Now, let us examine the main findings, both short-term and long-term. The primary outcome focused on how long it took for patients to recover. The median time to recovery was strikingly similar between the groups: 14 days in the observation group compared to 12 days in those who received antibiotics. This result confirms that observation is not inferior to antibiotics in terms of recovery time. As for secondary outcomes, the rates of complicated diverticulitis, ongoing or recurrent diverticulitis, need for sigmoid resection, hospital readmission, adverse events, and mortality were all comparable between the two approaches. Importantly, patients in the observation group had a significantly shorter hospital stay, 2 days compared to 3 days for those receiving antibiotics. Looking at the long-term results, a 2018 follow-up study tracked participants for 24 months. This extended observation confirmed the safety of the non-antibiotic approach. The recurrence of diverticulitis was nearly identical, 15.4% in the observational group versus 14.9% in the antibiotic group. Likewise, there were no significant differences in rates of complicated diverticulitis or sigmoid resection. While there was a slight trend toward more elective surgeries in the observation group, the initial treatment choice, antibiotics or observation, was not an independent predictor of poor outcomes. Interestingly, the analysis did reveal that younger patients, those under 50 years old, and those with high initial pain scores were at greater risk for complicated or recurrent diverticulitis, regardless of the treatment strategy chosen. The impact of the DIABOLO trial, alongside findings from the AVID trial, has been profound. These studies have directly led to changes in clinical guidelines worldwide. The evidence is now clear. For immunocompetent individuals experiencing their first episode of uncomplicated diverticulitis, there is no need for the routine use of antibiotics. Major surgical and gastroenterology societies around the world now recommend against antibiotics in these cases. To summarize, the DIABOLO trial provides robust evidence that it is safe to omit antibiotics for a first episode of uncomplicated diverticulitis. This approach does not compromise recovery and does not increase the risk of long-term complications or recurrence. Thank you for joining us today. If you found this discussion informative, please like, share, and subscribe for more in-depth analysis. This is the Everything Surgery podcast, where we dissect the extraordinary.